As new and more contagious variants of the coronavirus spread around the country, people are taking extra precautions, one of which is looking at the quality of face masks and whether two is better than one. So just how dire is the situation becoming? The CDC predicts at least 100,000 people will die in the first month of President Biden's term in office. It's unclear how new variants will impact this number. The Biden administration is urging everyone to avoid unnecessary travel, social distance, and to continue to wear masks. Health officials say the new variants can be found in more than half the country. And according to the CDC, the highly transmissible strain first identified in the UK will likely be the dominant strain here by March. And that has many people donning an extra layer of protection. With new, more contagious variants of coronavirus on the rise, the question has been raised: should we all be wearing more than one face mask? This video from researchers in Australia last summer showed masks with more layers clearly do a better job of stopping the spread of respiratory droplets. So, to double mask or not? It's a question that has some health experts weighing in.
This is a physical covering to prevent droplets and virus to get in. So if you have a physical covering with one layer, you put another layer on, it just makes common sense that it likely would be more effective. And that's the reason why you see people either double masking or doing a version of an N95.
While N95 masks are still the best option, they remain hard to find and experts say should be left to frontline workers. So what are the best options? An article in the scientific journal Cell found wearing a tight cloth mask on top of a surgical mask is greater than 90% effective. Wearing a 3-layer mask of a tightly woven fabric with a filter in the middle was also found to be more than 90% effective. Researchers say one of those options, if worn correctly, is comparable to the N95, which offers 95% protection.
The science is now clear that masks help reduce spread, and the idea is more layers give more protection. So 2 or 3 layers is better than 1. And the idea is to create a kind of obstacle course that helps block the virus.
While the CDC has not added this to their guidance, they do remind people when choosing a mask, wear one with at least 2 layers and make sure it fits snugly around your face. And joining me now with more is Linsey Marr. She is a civil and environmental engineering professor at Virginia Tech with an expertise in airborne transmission of viruses. Professor Marr, welcome. It's great to have you with us. So you argue that it might be time to switch to double masks. What has changed in our fight against COVID-19 that suggests it's time to upgrade what kind of mask we use?
Thank you very much for having me. The things that have changed are that we have new variants that seem to be more easily transmitted between people. The other thing is that because the number of cases are so high right now in the United States, that the chances of us encountering someone who's infected is much higher than it has been in the past.
So how do the 2 masks work to boost your protection against COVID? And should people be concerned about their ability to breathe while wearing an extra mask?
Great questions. So a mask acts like an obstacle course for particles, aerosols, viruses that are trying to get between the air and your nose and mouth. And let's say that a mask is 50% effective, which is reasonable for a typical cloth mask made out of a good material. If you have 100 viruses kind of heading towards that mask is going to block 50% of them. So 50 get through and 50 are trapped by the mask. If those 50 go on and hit another mask, only half of those get through. So now 25 get through, and you started with 100 and you end up with only 25 getting through, so you've increased your efficiency to 75%. However, you want to make sure that these layers, more layers is good for blocking particles, but you have to make sure they're still breathable, that you can easily breathe through them, because if it becomes hard to breathe, then the air is going to try to leak in through any holes or gaps that it can find on the sides, and then it's like having a hole in your mask.
And so what do you recommend then for people who do want to wear 2 masks? Do you recommend just one of those surgical masks that you buy in bulk and then a fabric mask on top, perhaps? I know that, the N95 mask is considered sort of the gold standard, but ideally those should be left to the, the health professionals, since they are still in somewhat limited supply. So how would you advise the average person who's looking to wear 2 masks do so?
Mask performance really comes down to 2 things: the filtration ability of the material and the fit. So the way that you can kind of achieve both of those things is if you use a good quality surgical type mask, which is ASTM certified, ideally level 2 or 3. That means it can filter out particles well. The drawback of those masks is that they tend to be kind of very loose on the side. They're not really designed to fit your face tightly. So if you layer on top of that a tight fitting cloth mask, you can really kind of hold down the sides of that mask so that you eliminate, hopefully, any leaks, while also adding another layer of filtration on top of that.
That is great advice. And so just in terms of the N95 mask, it is still the case that those are in somewhat short supply, correct? And shouldn't be hoarded by, the general public when health officials still need the bulk of them, correct?
I've heard mixed things now on N95. Certainly last year there was a shortage for healthcare workers. That may still be going on in some places, but I think if you find easily N95s in the local store, then you should buy those. Those are going to provide you the best protection available. But yes, we do need to be careful about ensuring that our healthcare workers have adequate supplies.
Well, that's good to know that they are available in some places. Why is the CDC not changing its recommendation at this point? I mean, first off, would you generally advise most people in most areas of the U.S. to wear 2 masks? And do you think that the CDC will up its recommendation to that at some point soon?
I think the CDC has been doing a good job of recommending masks to all people. They've recently changed their guidance to focus on a good fitting mask. And you can achieve a good performance also with one good mask. So I'm not sure that universally recommending 2 masks is the solution, because if you have 2 poor masks, then that's not the best thing either. What we really need are some kind of mask testing standards for that consumers can use.
Yeah, good point. You're right. All masks are not created equal. All right. Well, Linsey Marr, thank you so much for joining us. We really appreciate it.
It's been a pleasure. Thank you.